today, for the last 30 minutes of the show, we will talk about sports medicine with our featured guests, Hadassah Roberts and Paula Kim, co-owners and physical therapists for Optimal Physical Therapy and Rehab, LLC in Silver Springs, Maryland. Now, before we bring our guest on, I would like to ask the War Room Generals, what is the worst sports injury you ever saw? Jimmy.
Ooh, I got two. Joe Theismann and Tim Crumry. I don't know if you guys remember that. And I believe those were what? Those were actually a torn ACL. Well, I know that Tim Crumry's was. Theismann was the whole leg, wasn't it?
Yeah, it was his whole leg. A bone came out.
His whole bone came out of his leg. Yeah, those two I always will remember.
Okay. Brad, what's the worst sports injury you ever saw?
It was Napoleon Kaufman on Monday Night Football. Got his knee blown backwards, and he was under the pile, and they had to lift the whole pile up, and certain guys couldn't get up because of his positioning. I say that and Sean Livingston kind of tied.
Okay. PJ, what's the worst sports injury you ever saw?
Yo, I've never seen, just like Jimmy said, I've never seen an injury as bad as Joe Theismann. Like, I honestly still have a dream every now and again about that break when Lawrence Taylor jumped on his leg and it snapped like a Philadelphia Pretzel Company pretzel, and it just looked disgusting. Like, seriously, I can never get that injury out of my head. So, Joe Theismann is my worst ever, man.
That was crazy.
Okay. Dad, what's the worst injury you ever saw?
It had to be somewhere between Sean Livingston's knee injury and Willis McGahee. Like, your knee not supposed to do that, man. His journey was like a bow and arrow. Yeah. I thought he was going to shoot an arrow off in front of his knee.
Hey, Doc Bayon.
What's up?
Honorable mention would be LeBron's pride after this year's NBA playoffs and finals.
True.
All right, well,
yo, Dev, it's funny. Real quick, it's funny you brought that Willis McGahee thing up, because did you notice that after he came back from that injury, he limped for like 2 years, even while he was playing?
Yeah, that's what me and Akil talked about that the other day. Like, he limped, like, when he was walking. He still ran the ball pretty well, had a pretty good career after that, but he did have a little limp. And I'm pretty sure he was a little bit of, afraid of contact after that. Like, I would be. He's crazy for playing football again, but he made a lot of money doing it.
Did you notice those were all football injuries we named?
Yeah. I mean, it's brutal. It's a contact sport, so even the injuries are going to look worse because somebody's actually hitting you to make you do it. But we're going to get some help on this subject here, so we're going to bring our special guests onto the line right now. These ladies are physical therapists, and they are both managing partners of Optimal Physical Therapy and Rehabilitation in Silver Spring, Maryland. So we'd like to welcome into the War Room for the very first time Mrs. Hadassah Roberts and Paula Kim. Ladies, you are on the line. You there? Hello, ladies.
Thank you for having us.
Oh, okay.
Hey.
No problem. No problem. Thank you for coming and joining us.
Uh-huh.
Tonight, this is the War Room Doctors Group here. This is the practice we just started. So we're going to people. We're going to get them the knowledge that they need to have when the couch potatoes try to go out on the weekends and play sports and get hurt.
Right.
We're going to try to shovel them over to your place so you guys can make money off of their misfortune. All right. All right, so real quick, I'm going to ask you ladies a question because Akil just finished asking all of the hosts, like, what's the worst sports injury we've ever seen? And, from our perspective, it's what we've seen on the couch, sitting there watching games or whatever. Since you guys see this stuff close up, we were just kind of curious, what's the worst sports-related injury that you guys have ever had to deal with, or rehab?
I have seen, I would say for me, and this is Hadassah speaking, I would probably say definitely along with being the most common, I would say probably your ACL with combined meniscus and MCL tears. So what we call that in therapy is kind of like the unhappy triad. So where not only do you tear your ACL, but there's also meniscus tear, and you tear your medial collateral ligament along with it. Yeah.
Okay,
so
that's what I was about to ask you, because I thought you were talking like one by one, but you're talking about tearing them all at
all
once.
All three. Right.
I probably just quit life at that point.
Right. So all three are torn, and that's usually, you might see that more so in like football injury. So where they're usually, that one foot is planted, and then they, obviously there's a contact, and then there's a lateral force on the knee, so it causes and a rotary force, so it causes a tear of all three. For me, that's probably the worst. Obviously, ACL in isolation, I mean, it's enough anyway, but with the meniscus tear, rehab is a little bit, they're a little bit more conservative as far as treatment goes when they first come out post-op. Paula, anything else you might have seen?
For me personally, I think the biggest injury I've seen is a bilateral patella tendon rupture. And usually these aren't actually very common at all, but the one I did see...
sounds painful.
I know, right? It really is, and it's a long process. And it's funny because you just mentioned a couch potato, but this gentleman, he was a couch potato, and he went out one weekend trying to play football, and he went to go out for the ball, and he yeah, exactly. And he landed on both knees and ruptured both his tendons, and yeah.
Wait, so both of them? So he couldn't walk at all? He couldn't even limp because he broke both. I mean, he ruptured both of them, right?
Right. Yep. So he was in a knee extension brace for I think like 6 weeks, and he was both parts. He looked just a mess. But at the end, he was able to walk and he was able to run a little bit too. But he was in therapy for I want to say like 7 months.
Paula, this is Devin, and in 30 seconds you have just retired me from my flag football career. I will never try that again. But, Jimmy, you got something?
No, I mean, she pretty much. I had a question about what was the most common, but she pretty much answered my question. And how often do you see these injuries? I mean, is it just for people who are getting up off the couch, or does it happen in everyday life, or just like playing sports? Like because every time I hear ACL, I think of sports. Do people tear ACLs just doing normal day-to-day activities?
No, it's usually sports related. Yeah, it's usually sports related.
Okay.
Like you're not going to just tear it. Even I don't even think you would really just tear it just jogging.
Right.
Would you?
No.
Yeah.
Okay, because I see a lot of times like with
football players, skiing. Yeah. But it's not. Yeah, it's not something that just.
Because you see a lot of guys who try to lie. A lot of professional athletes, and they say, "Well, I fell down the steps, or I tripped over this." Wasn't it rumors that that's what T.O. had said as well? Like I wasn't working out. I tripped over something.
Well, he was supposed to be on the show when he did it.
Yeah,
he was doing it when he was shooting the show.
Oh.
Yeah. I think they've I think Drew Rosenhaus kind of
whatever.
I think Drew Rosenhaus said that wasn't true.
Yeah.
Put it to bed. Yeah.
He kind of put those rumors to bed. I mean, it doesn't mean that it's not true. We already spoke about Drew Rosenhaus and his word, but
Yeah, but some guys lie. And I kind of thought that it's kind of hard to tear your ACL like doing chores around the house. I was like, that doesn't sound
right. Washing the dishes. That's a good one.
Yeah.
My kitchen floor is
okay.
Oh God.
Solid concrete. It could happen.
Hadassah, this is Akil. How are you doing?
I am good.
Okay, now what's the normal procedure for repairing and rehabbing an ACL tear?
Okay, so surgically, what they do is, well, obviously, with the ACL reconstruction, they usually either use autograft, which is usually a graft from the actual person, or what we call an allograft, which is a graft from a cadaver.
Dead man's ligaments.
I'm sorry? What'd you say?
Dead man's ligaments.
Exactly, a dead man. Yep, a dead man's ligament. Yes, and usually that really depends on the surgeon's preference or the patient's preference, whether they choose, autograft versus allograft. If they use it from the patient themselves, it's usually either the hamstring tendon or the patella tendon. if they use the patella tendon, it can be a little bit more painful as far as rehab goes post-op. And obviously then they're, like I said, they can use a cadaver, and if they use that, a dead man's ligament, then they can take it also from the patella tendon, the hamstring tendon, or they sometimes do like the Achilles tendon, or what else do they take it for the
wait a minute,
sometimes
I have
the
a
quad
question.
tendon. There's a bunch of different places. What's up?
Do they just take these without permission, or do you have to be a ligament donor?
No.
I know you could be an organ donor, but they've never asked me on my driver's license if I wanted to be a ligament donor. Come on,
donate your
that's
gristle.
Funny.
Donate
usually I think that's a good question though, but I'm assuming they're just doing it from people that have already donated their body to science.
Right.
So
okay. I have a question.
So
this
if you
is,
think you
this
have
is
a bomb,
big.
Go ahead.
Oh, I didn't mean to interrupt you, Hadassah. Please finish.
Oh no, go ahead with your question.
My question is, if you're taking these ligaments from another person that's dead, is there a period of time that your body has to accept them or kind of integrate them into your body, or because you hear all the time of like organ rejection? Would there be sort of like, I guess, ligament rejection?
Ligament rejection.
Right. I don't think you really run into that. I think one of the only concerns that they usually have with is the transmission of diseases. But other than that, I don't think any studies have shown necessarily that one. I mean, you can get they're both pretty good, and then I don't think there are really any studies that show one is necessarily better than the other. I think again, like I said, it's a lot of times based on the surgeon and the patient.
Gotcha.
So, yeah.
B again, Paula and Hadassah, what exactly is the LCL, and why is it that we never hear of anyone tearing theirs?
Good, very good question. I'm doing y'all. Okay, so the LCL is
we've all been injured.
Right. LCL is the lateral collateral ligament. So basically it provides, so it's opposite the MCL, which is the medial collateral ligament. So the LCL provides more lateral stability for the knee. So the reason why you don't really hear about LCL injuries is, again, because of its location. So if, say, in order to injure your LCL or tear your LCL, the blow has to be towards the medial side of the knee. But if you're thinking about it, so say, for example, I am playing a sport, right? To get to my right leg LCL, to really injure my right leg LCL, you actually have to hit my knee on the medial side, on the inside. But that left knee is blocking it, so you don't really see that much injury there. You see what I'm saying?
Yeah, so that sounds like it would have to be like a freak injury, like somebody, like, say, football. Somebody would have to hit you at the perfect time when you're one leg is out in front of the other one.
Exactly.
And it still doesn't make sense. It still probably couldn't happen that often because that back leg wouldn't be planted on the ground if your front leg is, I understand.
Right. So, I mean, it's going to have to be like that split second, however long it takes for that, where that right leg, if we're talking about injuring the right LCL, is out of the way of the left, so it doesn't, block that inside of that right knee from getting a
you could
a
just be
blow.
stretching before the game, doing some lunges,
and somebody can just come
and
knock
somebody just come out and while you're lunging forward, because I can't really see it happening.
Right, exactly, and then there's that.
Yeah.
We're laughing at people's misfortune here, Gus.
I know, right? I know.
I'm saying some of these injuries we haven't really gotten to in their mind yet, but some of this was my misfortune. I'll let you know when we get to it. But I know Akil wanted to talk about his tendonitis. I have a little bout with tendonitis in the knees as well. But Akil, for the people out there who have no idea what it actually is, tell them like what your knees feel like right now.
Yeah, with tendonitis, and they call it jumper's knee or runner's knee. Basically, I feel soreness. I feel soreness on the front of my patella, which is like the right below the knee, every time I finish playing basketball or wake up in the morning, and it's just a constant soreness that never goes away. It causes a limp, and I mean I could take ibuprofen sometimes, or just not do anything. So pretty bad.
Yeah,
you said that's called jumper's knee.
Jumper's knee. Yep.
Jumper's knee or runner's knee.
Like I never had hop,
so I never get that.
Still ain't no hop.
Jump shot. One of those.
I wonder,
like, to piggyback off his point, like if I'm on the ground, like if I'm squatting or something, kneeling down to pick something up or whatever, it takes me a nice little minute to get back up these days. Like I feel like Fred Sanford in the knee.
How old are you?
I'm only 34. Well, I'm about to be 34 years old. I mean, I played a lot of sports in my life, and at this point in my life, I'm lazy. I don't do much exercise, so I'm not helping the cause. Because what people told me as far as trying to help the tendonitis or at least help the pain subside a little bit is that you should probably strengthen your quads, and that takes some of the pressure off your knee. Is that correct?
That is correct. A lot, some of the things, tendonitis, a lot of times is, you're being told that you have tendonitis, but when you're talking about something that you've had for a long time, because whenever you hear a term with itis at the end of it, it's usually referred to as inflammation. But that only usually occurs like maybe 2 or 3 days after the initial onset. So technically, if I want to get all medical here, I would say that's more tendinopathy that you have. However, and usually basically what happens is, like you were saying, quad strengthening is good. I'm not quite sure what the flexibility of your hamstrings are like, your quads are like, your hip flexors. So a lot of things to prevent injury, you really want to, or to just, when you're doing sport activities, you really want to make sure your muscles are in balance, whether it be with strength and flexibility, so that you really be able to perform optimally. So, you want to make sure you stretch. And you like how I threw that in there, optimally. Optimal.
This is B, and I guess we're all in our 30s, so some of us, our careers are winding down. I still play a little basketball myself, and my knees hurt at all times, but my wife just told me because I'm fat. And I be playing with 18, 19, and 20-year-olds, and they're not fat.
That's why it's hard for me to strengthen my quads sitting on the couch. But PJ, you had a
question. So, ladies, I have a question for you. So, basically, what's the difference between a strain, a sprain, and a tear? Because I hear like strain and sprain. Those two terms are used, either one can swap out for the other. Yeah. Right. But, I mean, obviously a tear is different. But what's the difference between the three?
So, pretty much a strain is just a micro tear in the muscle or the tendon, whereas a sprain is an injury to the actual ligament. So just like with the strain, it usually happens in response to like a sudden twist or a pull of a muscle. So a good example is, I guess, a guy playing baseball, and he's playing defense. And, they're kind of just squatting down a little bit. They're waiting for the ball to come. And so let's say if it's kind of short, they're just standing there, and then they go all of a sudden to go propulse, and they just kind of go and try to catch it and run for it. That's usually the typical way you kind of strain something. Whereas like a sprain, your typical one is an ankle sprain where, your ankle just kind of rolls in, and that's just like a sprain of just the ligament. So that's pretty much the difference with the strain and the sprain.
Okay.
This is Devin. Okay, PJ, I'm sorry. Go ahead.
No, I was about to transition to you anyway. It's cool.
Okay, that's what I was going to tell a personal story here. This is right up you ladies' alley. A few years back, I was playing flag football just like the guys who come in and see y'all, still trying to live the dream, right? So I had a really bad ankle sprain. Now, since I've done this all of my life, you just think, I just do the regular things, but you don't realize once you get older, it starts to be a little more difficult to heal. So I actually played on this ankle, like, for the next 2 weeks. And then I finally decided that I should probably see a doctor. The doctor then referred me to a sports medicine doctor. And he put me, he sent me to people like you guys. So I had like 12 weeks of physical therapy on the ankle. By the way, the electric stimulation thing.
You love it, huh?
I could do that like every day for no reason. But
most of our patients can.
That and the little, the ultrasound when they put the jelly on.
Paula loves giving ultrasound.
So the 12 weeks of therapy, it didn't heal the ankle like they thought it would, so they sent me back for like 4 more weeks. Now, at the end of that 4 weeks, they told me since this didn't work, if this last round of therapy doesn't work, we're going to give you a cortisone shot. If the cortisone shot doesn't work, then we're going to have to do surgery. Can you guys explain to the people? I know, but I couldn't explain it like you guys. Could you explain to the people what a cortisone shot actually does?
So, cortisone pretty much is a steroid, and it's injected into the joint, and it pretty much is just to relieve inflammation. And the biggest misconception is it's given for pain, which it's not. It's more to get rid of the inflammation, but by doing that, then you get rid of the pain.
You get rid of the pain, right. Okay, so I didn't really know that I was on steroids. It actually, it worked.
Breaking news.
Like, I'm going to get in trouble for this. But
right.
It actually ended up working, and I'm glad she explained it. I'm glad Paula explained it, because the way I explain it to people, in layman's terms, I do use the word inflammation, but I'm like, the tissue is so inflamed inside of my ankle that it's like whatever's in there is too big for my ankle to hold. So it's like rubbing up against the outside of my ankle. Which makes it really painful.
Say nice.
Which makes it really painful. So the shot, right after I got the shot, maybe like 30 minutes after I got the shot, it felt like my leg was going to fall off, though. It was really.
All I want to know is, do we have to forfeit all them wins we had when you was on the roids?
Right, exactly.
Yeah, I was. No, but really, when I was on steroids,
I won't tell anyone.
Because remember, Gil, we were going to coach a game, a tournament in Baltimore the day I got the shot. And I was sitting in the front of the bus looking like I was going to cry because my leg felt like it was about to fall off.
Hey, Doug, let me ask him a quick question. We're running out of time. A lot of times these athletes that get injured, they spend time in a hyperbaric chamber. Does that really work?
It was actually originally made, I think, for like medicine, like for people with diabetes and wounds and things like that. And now, the theory really is just supposed to be the higher the oxygen level you're at, the quicker your recovery will be. Like I know some of the football players have, like T.O. has one, Kevin Burnett uses one, I guess, too.
Yeah, they have them in their house now.
Right. Yeah.
Michael Jackson really started all of this. Michael Jackson used to have
exactly. Michael Jackson started it, actually.
He was trying to heal his skin from all the stuff he was doing.
Yeah, and it help increase, I guess, the recovery period. But whether it works tremendously, it's still kind of unknown. So.
Okay.
It works for T.O.
It's like a new age. They're like one of those new age grandma cures. Like
they need to put
grandma told you need to get in your chamber, baby.
They need to put LeBron's heart in a hyperbaric chamber.
Wait, listen to what it's replaced Bengay.
Yeah, they don't need Bengay no more. Baby, get in your chamber.
Right.
Hey,
I call you
real quick.
Ready.
Hey, ladies, real quick. This is Akil. I have another question. Are certain people more prone to injury than others because of their genetic makeup?
Let's see. ACL. I would say women, you will find more likely to have ACL injuries than men. And that's basically because of their structural makeup. Like our hips are usually wider, so it increases this, what we call like a Q angle. So that puts them more prone to ACL injuries. And typically also because of the whole, with our estrogen levels, especially at certain times of the month, that decreases the strength of the ligaments become a little bit more lax. So then
I've never heard that.
Wow.
So basically,
that's interesting.
A female basketball player whose time of the month it is, she should probably sit out.
Right.
Serena's in danger.
Honk it.
Her hip span.
Honk it.
Her hip span of.
Yeah.
Man, never mind.
No, but she's built more like a dude though. So now I understand why Sean Livingston keeps getting hurt, because he's built more like a woman. It all makes sense.
Oh.
It
now,
really
what about
does.
Greg Oden? What about Greg Oden and Larry Hughes?
Kevin Garnett should have been injured every year then.
He weighs like 113 pounds at 7 feet tall.
Soaking wet.
Okay, lady, real quick. Hey, two quick things before we let you ladies tell everybody, your information before we get you out of here. Hey,
okay.
PJ, I remember in high school, because we all played high school basketball together, I remember you had like a hyperextension of your knee.
Yep.
Like, what exactly is a hyperextension? Like, and how does that feel? I've never had that. It looked nasty when it happened.
It felt definitely weird, and I remember having to rehab it. There wasn't really too much rehab outside of just staying off of it. Yeah, well, it was like a couple weeks. Because remember, for 1 week I came to school with crutches. My dad was bringing me to school, and I had to be on crutches for a bit so that one knee could be off. I wasn't putting any weight or pressure on that knee. I think that happened, I guess, in 12th grade. I don't remember the actual what it was, but maybe you ladies could speak to the hyperextension. I guess your knee just goes the wrong direction or something.
It's not. Well, okay, the normal. Okay, so if you're standing, right, your normal knee extension, so when your leg is straight, normal is about 0 degrees. That's ideal,
right.
But there are some people that go beyond 0 degrees. So that's what we call hyperextension. So if you're straightening your knee out and it goes, have you ever seen people stand up where it's kind of, I don't know how to explain it otherwise.
They call them bow-legged.
Stand up, they're
kind of like a cocky bow-legged
yeah, like a bow-legged, yeah.
Well,
I mean, that's probably wrong medical explanation of it, but
we'll ask you guys about it on your Facebook page because we are running out of time. Real quick, when I was 6, I broke my thigh. What's that? The fibia, the biggest bone in your body. Had a body cast.
But I like how you combine the tibia and the femur.
Tripping. Had a cast that went all the way up my left leg, over my hip to the right side, went halfway down my right leg with a bar in the middle. So I looked like an A for like 10 weeks. That's my last story.
Right.
All right, so real quick before we get off the air.
Dev is injury prone, yo.
Yeah, you guys want to tell everybody how they can, find you guys, where they can find you, email address of your practice, everything.
Okay. So on the web, you can find us at www.optimalptr.com. When you're there, if you go on the contact page, it has my email address and Paula's email address there, or you can email us at info@optimalptr.com. We're in Silver Spring. Our address is 1738 Elton Road, and we're at Suite 230, just about a half a mile from the New Hampshire Avenue exit, which is exit 28A on the Beltway 495. So we provide physical therapy services. We do work conditioning, work hardening, functional capacity evaluation. We not only treat sports injuries, we treat your general population. So if your grandmother is having some achy knees or tore her rotator cuff, or as she might say, rotor cuff, send her our way. We also see hand injuries also. That's something that we specialize in also. And we have same-day appointments, and all major insurances are accepted. And you can also find us on Facebook.
All of this information out on our Facebook page. Ladies, thank you for joining us tonight.
Thank you for having us. We hope we answered a lot of your questions.
We will do this again because we have some more stuff to talk about.
Okay.
So thank you. Thank you very much.
Thank you, guys.
Thank you.
Thanks, ladies.
Bye-bye.
Bye.
Kuwait, it's the war room with 5 nights at the round table. 5 Philly guys, diversified and educated.